Hi everyone, my name is Lisa and I'm one of the speech therapists here in Mighty Oaks. And today I'd like to show you the fun things that we use in a usual speech therapy session. The name speech therapy in itself is a bit misleading because we tend to think that we're only talking about words, but actually words are just a small part of the whole communication process. So here in Mighty Oaks, we like to talk about nonverbal language. And one of the first things that we do when we teach nonverbal language is to have the children focus on the facial expressions. And we start that with just simple imitation games. So we just pretend to be this. What was that? Or we pretend to be this, and this, and this. So we practice that, and then we turn it into a fun guessing game. So one child will pretend to be this, and the other guy is pretending what he is. And then they take turns. So why are facial expressions very important? If you think about it, it's one of the skills that emerge before speech. So a baby, for example, will look at its parent's face and make his reaction based on what mom or dad is showing. So it's very important also for a person or a child to know that, because it gives him an idea of what the other person's intention is. And then he draws out his words based on that. Then one of the things that we also like to do is to give them an idea of what your body feels when you're feeling all of these emotions. So I'd like you to meet my friend Banya and my friends Banya and Jambi. So Banya here is showing us what it feels like to be calm. So when he's calm, his eyes look happy and he can think clearly and his mouth is smiling, he's taking deep breaths. He's breathing slowly, which is very important, and his legs and feet stay in one place, and my body is calm and relaxed. So that we show this, and we tell the kids that this is what your body is showing me. Your body is showing me you're calm. And this is what freaking out looks like. So the hands are all over the place, his eyes are wide open, and he is thinking about his worry. His heart is beating fast. He's talking fast, and his whole body is not still, and his body is tense. So that is what it's looking like. So after this, it's really important for the children to understand the signals that their bodies are telling them. So we sometimes act it out in pretend and safe situations, because they need to get the signals of what their body is telling them. And then we go to what are strategies that they can do when they are sort of freaking out. This is also something for adults, by the way. So you could get a hug, you could ask an adult for help, or you can take 5 deep breaths. So those are for our more verbal ones.